I don't know. We played them before. I don't know when. It's like really just hot in here.
Do you have another shirt? Cardiomyopathy is a cardiac dysfunction caused by diseases of the heart. You might have one or more. It can be ischemic with cardiovascular disease and heart failure. It's a series of events where sodium is food retention, increased workload, impaired cardiac output, causing heart failure. Dilated cardiomyopathy is the most common and most significant dilation of ventricles without hypertrophy. No hypertrophy. Basically, it's just heart failure. Basically, it's just like an enlarged something.
Ventricle?
Ventricle. I think it's your left ventricle, is it not?
Probably.
Yeah, left ventricle. Causes systolic dysfunction, so there's less blood ejected from the ventricle during systole because it's like diastole is like too much, and then it's like trying to pump out all the blood, but it can't. It can be caused by alcohol, pregnancy, viral infections, chemo, or thyroid dysfunction. It's caused mostly though by hypertension. Use EKG. First $3 of easy screen is hereditary. It's like a thin and weak left ventricle that decreases contractility, ejection fraction, and cardiac output. Restrictive cardiomyopathy is a diastolic dysfunction, so the filling is like not good because it's like a rigid ventricular wall. It's like a non-compliant rigid ventricle. Caused by amyloidosis, I don't know. Causes dyspnea, non-productive cough, and chest pain. Like honestly, like probably wouldn't find it. Just your heart maybe. Hypertrophic cardiomyopathy is whenever your heart muscle is when your heart muscle is asymmetrically increased in size and mass along the septum. So unlike restrictive cardiomyopathy, where the ventricle wall is like extra rigid, hypertrophic cardiomyopathy is when the actual septum, like muscle wall, is too large, like too swollen. Autosomal dominant trait, it happens after puberty. Screening is necessary with anyone in the family, like anyone who's had a death in the family, sudden death, like anyone under 50. So like, say like, oh, Darby died all of a sudden, and we need screening. Usually asymptomatic until you like are exercising a lot or you die. Detected during physicals, that's like one of the main things they look for. Echo, EKG, history, genetic testing. Ventricles take more time to relax, and then they're quick to fill. So they're at risk for dysrhythmias. There's a reduction in cardiac output. There's preserved ejection fraction because there's a decreased volume in the ventricle because all the space is being taken up by muscle. Clinical manifestations is that they're asymptomatic for a while, then there's heart failure side symptoms, exertional and nocturnal, dyspnea, cough. All of the cardiomyopathy can often be just mixed diagnosed with bronchitis and pneumonia. That's fluid retention, swelling, chest pain and palpitations, with hypertrophic cardiac arrest in young athletes. Assessments and diagnostics include early on, like you're going to find tachycardia, S3, S4, heart sounds, crackles, edema in your extremities, ABD, hepatomegaly. We're going to do an echo, cardiac MRI for hypertrophic, an EKG to look for ventricular dysrhythmias, AFib, changes with hypertrophy, YQS, inverted T waves. Like, how am I ever going to remember
You guys play in the shower?
shower?
I don't know. I thought you were talking basketball.
We're studying nursing school.
My daughter.
Not a shower.
Shower.
I wish we.
I wish, yeah.
We're just studying.
He is cute. We're hitting a shower.
Are you planning a shower or something? I freaking. Do you hear what we're saying right now?
Yeah.
Changes with rep. Okay. Test extralucid enlargement of the heart. This is like a lot of them are for like hypertrophic. Like the hypertrophic is going to show like an enlargement of the heart. It's going to show. You're going to see that on an MRI or a chest X-ray. To be honest. I don't know. Medical management. Identify at-risk patients. Treat heart failure. Low sodium diet. Exercise. Antidysphorismics, pacemaker, IC, anticoagulants, monitor I's and O's, potentially a fluid restriction. If you're hypertrophic though, like you're an athlete, like avoid dehydration at all costs. And you're going to be a beta blocker with hypertrophic. Surgical treatment might be a myectomy. Remove septal tissue. Transplant, LVDs, balloon pumps, blood pumps. We'll talk about that, to be honest. There are types of inflammation and infection in the heart. Rheumatic endocarditis is, guess what causes it?
Strep.
Huh?
I said strep.
It's like everything is caused by strep ever. Post-traumatic fever is an infection of group A beta hemolytic strep.
Bro, how are we supposed to remember all this? Like, genuinely. This is a 100-question test.
I need like 8 of them to be over like therapeutic communication. What do I
We need like 8 easy med calcs.
I legit for immediate, to be honest. Like, I would like to know what I got wrong with last.
It's like hard with the final. There's on the time.
I mean, we don't have to make that.
Yeah. And it's not like you can do it over Zoom.
How tall is Josiah?
5'10".
He's not 6 foot.
I don't know.
'Cause this guy is taller than him.
Who?
Floppy hair. On the other
Green?
Uh-huh.
I don't
Well,
know.
maybe not, but not by a lot. I think he's at least 6 foot.
Maybe, I don't know. I'm bad at explaining people's height. Yeah, you see that tall? I said 5'10".
Like, I was like, he's not 5'10".
Okay, I'm like bad at knowing people's height.
Like, Joe's like 5'9".
Ask him, I don't know. Maybe, I don't know.
Huh?
How old is Josiah?
6.
Yeah. We're like here now.
Okay. Make sure to take post-course antibiotics. Kids in third world countries and rural areas are the ones who usually get it because you don't ever treat your strep, basically. Infective endocarditis is whenever there's like microbial infection of the endocardium, and then basically there's like nasty vegetation.
Wait. This is infective, right? Or okay. Rheumatic is not. It's just strep.
Infective is the vegetation.
So what happens to your heart with rheumatic?
Heart murmur, cardiomegaly, heart failure, pericarditis. It's
Like
inflammatory.
Whatever.
Like, I don't know, your strep throat, it's like inflaming your tonsils, and then it like gets down into your heart, and then it causes like cardio, like fat heart. The lining of your heart, and heart failure, and of course you're gonna get a heart murmur, all those things.
Okay, sure.
Infective
It's
endocarditis.
veggies.
Veggies.
From
in-
something.
Accumulation of fibrin and platelets, and like basically clots in your endocardium. The infection circulates to the bloodstream and deposits vegetation into the endocardium. The vegetation erodes, through the endocardium, breaks down the valves, damages leaflets, and chordae tendineae.
Bruh.
Basically, like clumps of bacteria and stuff like form from like nastiness. Like it's like from like bacteria causes
Think about disorders.
older patients, IV drug users, or
Oh, true, like
hospitals,
IV drug users.
or hospitals require
True.
like PICC lines and stuff.
That's true. I think that is important. Yeah.
So like PICC lines, like
It's like a blood infection.
yeah, it's like literally like microbial infection, from like
Gets
from
to your
a PICC
heart.
line.
Yeah. Okay, that makes sense.
Prosthetic heart valves, yeah, like because they like literally get infected. There's an infection inside of your heart.
Like veggies everywhere, and this is the one where it's like it has a thing in your fingers and like in your eyes, like petechiae in your fingers.